quarterly event, building, seeing how the extent to which immunization professionals from all over the world have taken up the call to get to know each other better, network at a critical time for immunization. So in the last edition on 10th of September, we had 4,454 immunization professionals who registered in order to participate. We know many of you were disappointed because of connectivity issues and technical challenges, and some of you were in the field, but nevertheless, we know that you were there in spirit. And you can see here the actual numbers. Nigeria and DRC were the two countries with the greatest number of participants, but you can see many, many countries, including some that only had one participant in Teach to Reach. So now, what we want to share today is a few of the insights. We've prepared a complete, a really comprehensive slide deck, sharing really the key takeaways from Teach to Reach Connect, and we'll share that with any partner or anybody who's really interested in seeing what these insights are about. But I want to start here with this quote that from a participant who summed up the value of networking. Charlotte, are you available to do a quick reading of this first quote?
Yes, Reda, with pleasure. I had the privilege to interact with very highly qualified, internationally recognized health professionals. It's like an opportunity to dine with the creme de la creme of global health.
All right, we've got a little bit, creme de la creme is one way to put it. And certainly there's people from everywhere who are together, and you get one-to-one meetings with them and get that experience of being able to directly engage. And I heard similarly from folks working at the global level how much they learned by interacting, by connecting with the creme de la creme of national and subnational immunization staff. Value of networking should be obvious, but we find that Teach to Reach Network Connect participants have a really remarkable way of summing it up. Networking brings learning to my doorstep. I would not have acquired this without this innovative learning platform. Now, the question is, of course, fine, sure, people can enjoy networking. Does it actually make a difference? Hence, this quote is something that Charlotte and Boo, who actually put this comprehensive slide deck together, pulled out and identified. This is somebody who works in a rural area and has no connection to outside experts. And so it turns out that for this person, in the face of many, many questions from the community, after Teach to Reach Connect, she says, I have evidence to convince any resistant people. This event was amazing to me. This is a kind of eureka moment. This is the kind of realization that we get that we've consistently seen in Teach to Reach. And you can see here that on the average, the people who actually make it to the networking spend almost 2 hours networking, meeting with each other, discussing, exploring key themes. We're going to share what they were in this on the 10th of September. Now, furthermore, this is very much about interpersonal communication. So you push a button and you're connected with an immunization staff from somewhere else in the world. But we still want to know what people do with that, what people take away. And so we were amazed to see that over 1,000 participants responded to the post-event questionnaire, and 364 respondents didn't just check the boxes, but actually shared, in some cases, very detailed, rich stories on the three themes. So that's 364 people who shared stories around three key themes. The first one was leadership for Immunization Agenda. And Charlotte is going to sum up and read this first quote from one of the Teach to Reach Connect participants.
Effective immunization leadership and teamwork are required for successful immunization programs. Every immunization leader must be effective in leadership and be a good team player.
All right. And then we have the next one. So initially we were struggling with supplies, coverage, and somewhat vaccine hesitancy. Then we applied polio eradication and routine immunization principles in our COVID-19 vaccination campaign, and we got huge success. Now imagine if in the context of meeting with peers, people like yourself who are facing many of the same challenges, even if where they work could be completely different. Hearing a story like this and seeing the possibility of actually achieving, being successful with COVID-19 vaccination. Of course, it's always more complicated than that, but those exchanges are of huge value, especially when they're combined with global and other kinds of and country expertise. Now, Charlotte, what is this one about?
Okay, I talked about low coverage in my area and was happy to learn how coverage issues are being addressed in other parts of the world. And one more thing is that to improve the coverage, we need to work on both aspects, that is supply and demand.
Now, we don't know, of course, the context of these participants. There's lots of, they raise these comments or these quotes raise almost as many questions as, the information, the answers they provide. But they're fascinating insights from participants. What did you gain? We asked, and these are the kinds of responses that we got. Now, the second topic, which was the theme of the second networking session, is COVID-19 vaccine equity. Charlotte, could you tell us what is vaccine equity exactly?
Thank you, Reda. Vaccine equity is about making high quality vaccines accessible to all people that need it everywhere at the same time. And talking about that, I have in mind mostly the target populations that we have in mind. I have in mind also those that are living in hard to reach areas or security compromised areas, looking for ways and strategies to ensure that all of these populations are reached. That is, every last child, every last person in need of vaccines gets them. And within the context of the COVID-19 vaccine rollout, we know that the normal target that we usually have for vaccination services changes slightly because we are looking at healthcare professionals and adults that are becoming the target for vaccination. Thank you, Reda.
Now, this is out of order, but it's super interesting. It's actually Amel Eltaher referring back to the discussions and the stories we heard about gender, but also about campaigns, who says we need to change the way we conduct campaigns. In Sudan, the time of polio during campaigns, we used to just put a song about vaccination in all supervisors' car. Once children hear that, everyone will come out. And also, Amel welcomed the polio team. She may have known Michela, the previous speaker. Now, what's interesting, and we love this, is that Mary Adomako, Mary, please do tell us what city and country you're connecting from. We know Amel is in the Kingdom of Saudi Arabia. Mary says, good point on the campaign strategy with the use of songs relating to immunization. And we're hoping that in the context of this Insights work and what we're calling Insights Live. So this live stream, this live bulletin, sharing experiences, stories, that you'll also speak back to us. Ask, not only say hello or ask questions, but also share your stories as well. Now, to get back to the networking session 2 on vaccine equity, Charlotte defined vaccine equity for us. And here is the quote: "We must always simultaneously work out solutions towards saving the lives of both immunization workers and that of the eligible receivers of immunization." Now, networking session 3 was on innovation in immunization. And here we have probably the longest quote, and it may be challenged in a number of ways. It may be a bit provocative. It may break with conventions or the way we think about a number of issues, but this is quite a long quote. We struggled to sort of simplify it. Charlotte, can you tell me what this person is actually proposing?
Okay, so rather this person is kind of like bringing out an idea where public areas could be scouted. That's areas where people congregate and use the platforms for immunization and catch-up. So he says, although logistics will need to be carefully planned, burials, weddings, churches, and other public forums could be used to give vaccines, including COVID-19. For example, he was thinking that if WHO or other partners taking proposals from private clinics or health-related agencies who are willing to advocate and work in collaboration to ensure that their catchment areas are getting immunized.
All right. So, I'm struggling to imagine if a family is burying one of their members, or in the context of a wedding and vaccination taking place in that context. But I think the point of, and the challenge with this session on innovation in immunization was to think outside the box, and at least consider even the ideas that don't seem realistic, or that that seems like they would have no chance to fly. But who knows? The one thing that's certain is if we keep doing the same old things, we'll get the same old results. I'd like to turn to Calvin Tonga. I don't know if you're still with us. This certainly wasn't planned to ask you about this, but you're in the national EPI team in Cameroon. If somebody comes to you with an idea like this, what do you do? I mean, and you may not be able to answer us, but maybe we'll follow up with you after this session. Calvin, yes.
In fact, we are up from peers from the field. Yeah, thank you, Reda. I just wanted to say that we are open to ideas from all over the world, and also from our peers in the field. And as a fact, we've already received many ideas from the field that are being implemented. We also have the opportunity to see how colleagues in the field shape the strategies that we communicate to them, to their context, and how they adapt it so well that we can transpose them in other settings. So we are really open to new ideas, to new strategies or approaches, the final aim being to reach the last child.
All right. Okay. Thank you, Calvin. And so, what would be your initial response to somebody who says, well, can we do vaccinations when a family is burying one of their own, or during a wedding, or at a church?
This will be, I didn't get your question very well. Rita. Can you come again, please?
So this person is actually suggesting that, for example, during burials or during a wedding, that vaccinations take place during those times.
It really depends on the context. For example, we know with the COVID context, if we are talking of COVID vaccine, this is possible as long as you discuss with the family, and it gives them the opportunity also to make sure that those who take part to the ceremonies are vaccinated. So some sort of contributing in preventing the risk of propagating the disease. I think this may work, but in other contexts also it might be difficult because people are mourning their beloved person. So it all will depend on the context, and also on the discussion that you have with those who are in charge of organizing the ceremonies, if they accept that or if they refuse.
So we're talking with Calvin Tonga from the National EPI team in Cameroon. It certainly sounds like your team is open to innovation. We're sharing a few of the insights. There's a comprehensive slide deck developed by Charlotte Mbou about this unique event that brought together 4,454 immunization professionals who registered to participate. And I want to go now to some of our listeners. So let's see. First of all is Akhtar Mohammed Isarakai, who says we need to get support from the community for vaccination, and vaccine equity is important, which should be done by government to reach vaccines to all people of the country. Vaccine distribution should be based on targets. The COVID-19 vaccine campaign cannot implement with polio because polio volunteers have very less knowledge. That is Akhtar Mohammed's opinion. We'd like to know more how you form this opinion, certainly, but thank you for sharing. Amel says one more interesting story in a place in Saudi Arabia during the wedding. They make that to allow only vaccinated people to participate and attend. So in Saudi Arabia, vaccination status is digital in everyone's phone. And Akhtar Mohammed Isarakai has a question: how can we increase awareness about COVID-19 vaccines if we don't have much HFs in health facilities and health workers? So this is the kind of question that, Akhtar, I'd like to invite you to join Teach to Reach. The next one is on the 10th of December, and share with us. Now, we have one last one that is in French, so I'm going to very quickly translate it. A surprise to learn from my peers how successful they had been in vaccination during campaigns. From now on, I will be motivated and committed to innovate with communication strategies based on the engagement with local authorities in order to successfully succeed with vaccination efforts. So this is it for this first Insights Live bulletin. It's the first time we're trying something like this. We had 3 themes and I believe at least 8 guests, some from the country or subnational levels, and others from the regional and global levels. Wherever you are from, we're convinced that we need new kinds of insights, a new kind of insights as a global community. We recognize the significance of local action, but we need fresh insights to support those of you who are leading change. That's it for this session. Thank you. I want to thank Charlotte and Ian, who prepared a lot of what you heard discussed today, and we look forward to let us know what you think of this kind of a live stream. Is it useful to you? Is it worth listening to? Should we do more? Should we give up? Should we stop? Let us know. Give us your feedback. We are constantly listening and reading your comments. Thank you for those, and wish you well, and take care.